Hi, this is Smriti. I'm going to explain the presentation on case study of Miss Helen Georgopoulos. So starting with clinical manifestation that lead to a diagnosis of acute anterior STMI. Some of the clinical manifestation were central crossing chest pain with radiation to jaw, ST elevation, and elevated troponin. So chest pain with radiation to jaw, the most frequent complaint of acute myocardial infarction is chest discomfort. They are frequently described as different afferent fibers of vagus nerve which communicate nociceptive information to cervical neuron, which state chest pain is mostly a symptom of STMI. Tooth, jaw, or face pain might be also a sign of myocardial infarction. Another manifestation was ST elevation. ST elevation occurs when the depolarized ischemic area produce electrical currents that are repolarized. As a result, the baseline voltage previous to QRS complex is depressed when the ventricle depolarizes. Whole muscle depolarizes during ST segment, resulting in electrode recording zero voltage. The last one was elevated troponin. So elevated troponin, the troponin is elevated that play a crucial role in contraction type of muscle, including the muscle quantities that reflect their age, sex, and heart mass. Elevated troponin in cardiac arrest and pulmonary embolism indicate individuals at high risk but have little impact on their care, and increased cardiac troponin is linked to the worst prognosis in adult and children illness examined so far. So those are the clinical manifestation. The next one is the next number is nursing intervention to care for Miss Georgopoulos in emergency department. So there are 5 nursing intervention that has been picked for Mrs. Georgopoulos. First one is initiate supplemental oxygen if SpO2 is less than 93%. According to Kozima, it is said that patients who have oxygen saturation below 93% need additional oxygen treatment. So hence we need to initiate supplemental oxygen if its SpO2 is less than 93%. Next one was attach continuous cardiac monitoring. To gather baseline data and identify any worsening following a myocardial infarction or ongoing cardiac monitoring is crucial. It is said by Romanov et al. 2017. The third one is monitor blood pressure and report systolic BP is less than 100. In case of Mrs. Helen, monitoring patient blood pressure is essential since low systolic blood pressure and tachycardia are a sign of an impending cardiac failure. Record a 12-lead ECG. It is said that the 12-lead ECG must be recorded within 10 minutes of the arrival in ED to identify ST elevation in the patient who are in high risk. Perform venipuncture to collect pathology, troponin, UEC, FVC, and TFTS, LFTS, BSL. According to Hussar and Wesley, these both are myocardial ischemia cardiac indicators. Hence, it need to be collected and checked in pathology. So, going to the next slide. I want to explain the role and importance of cardiac reperfusion. The purpose of cardiac reperfusion is to increase blood flow through a clogged coronary artery and lessen myocardial ischemia, or should be initiated during the acute period of myocardial infarction, help to diagnose the degree of myocardial ischemia and protect the heart from sustaining more harm. Also indicate that primary percutaneous coronary intervention or the use of fibrinolytic drugs can achieve cardiac reperfusion. Going to the next slide, We are talking about the nursing consideration related to medication given to Miss Georgopoulos: aspirin, heparin, morphine, nitroglycerin, and clopidogrel. The nursing consideration related to medication given are: first, aspirin. Aspirin has both positive and negative effects that might be dangerous. It can reduce and stop. It also raises the chance, stop the formation of thrombus, but also raise the chances of bleeding. Hence, according to the nursing consideration, the patient should be monitored if there is any blood outcome of the body. And the next one is nitroglycerin that has been ordered by medical officer, 600 milligram. So nitroglycerin and also heparin. Nurses consider monitoring bleeding, and according to Hannah 2022, heparin together anticoagulate cysteine increase the risk of bleeding in many hemorrhagic episodes. Hence, it also increase the side effect of blood pressure. Hence, together can increase the risk of bleeding. Hence, it should be monitored that if the patients are bleeding in timely manner. Next one is clopidogrel. It is a drug likely as aspirin. It also has a likelihood bleeding episodes. So if it's combined with another antiplatelet medication, the nurses should monitor any bleeding events in the patients. Another one is morphine. Significantly influence the central nervous system and can produce blood pressure instability and respiratory distress. Nurses should regularly check all patient's vital sign, particularly blood pressure and breathing rate, and regulating medication through IV. And also, while applying medication through IV, nurses also should check the IV site about their bruises or any leakage. Nurses should think about that. So these are the 4 question answers answered in my presentation, which I also have submitted in transcript. And thank you so much.